Welcome to the Occupational Safety Leadership Podcast, episode number 202. And in today's podcast, we will talk about incident investigation process steps. And I really hesitate to call it steps because, like most things in life, there's going to be a nuance. So let's not think about this as like you do step one, step two, step three. This is just, let's think about this more of a checklist. I should say either, there are some things that you want to do first, and then others you can kind of do in parallel or afterwards, of course. But let's think about this whole thing with the nuance of there's not the perfect incident, and thus there's probably not going to be the perfect incident investigation steps. So let's just dive right in. So a incident has happened. So um, given a perfect scenario, we want to go ahead and secure the area where the injury occurred, and you would have somebody help you to do any photographs and video. Obviously, check your company policy first, just to just to make sure. But in an ideal world, the area is secured. People haven't started to do any cleanup or back to everyday things. You could also be tackling multiple sites, which means that by the time you get there, it's well over, of course, and done. Um, so in an ideal world, we secure the area, photograph and video things. So we gather up any of the witnesses. So we do everything we can to interview the employee and interview the witnesses. Depending upon the injury of the employee, they could be down at the first aid station, hospital if it's really bad. Um, so may have to focus on the witnesses first before that you get to the employee. So then we want to form a team. We want to go back and investigate the incident to ensure it doesn't happen again. So it's bad enough when you have an incident. The worst thing that you can do is not fully investigate it, chalk it up to, it's just an incident. It'll never happen again. And then it just continues to happen again then. So then after we investigate the incident, and we'll have some separate podcasts on the individual parts of this then too. So I'm just kind of breezing over in an ideal world. Um, so then we would go ahead and implement the changes because there's got to be something that can be fixed. You know, I know that people like to chalk it up to it was operator error. They didn't follow the SOP. They didn't, and part of it, of course, is once we start to investigate the incident, it'll be almost like peeling the onion back. We're getting to the layers. We're trying to understand why somebody, and of course, part of that is we're going to look at the training, the supervision. Um, did the employee do this in the past and was not corrected, and thus got that reinforcement that, well, if nobody cares, I can just keep on doing this. So there's a lot of reasons why that to go ahead there and look at. So after we document that, we implement the changes. And one of the big things that we do is we have to follow up on these corrective actions. So when an incident happens, just like the Hawthorne effect, there's a lot of light on it, there's a lot of energy, but what we don't want is for it to seem like a flash in the pan. We care about it now, but we kind of start to go back to the way things were in 5 or 6 months when the people are kind of forgotten about it. Maybe they're not really focused on the changes. Maybe maybe they implemented the changes in a half-hearted attempt, and it doesn't mean that they don't care. But like all things, we get supervisors are being pulled in a lot of directions, a lot of tasks, a lot of so as safety professionals, we see it as something that's really super important and it has to be done. And not that the supervisors don't see it as that way, but to them, it could be one of 10 things that have to occur. Um, so we always have to go back, follow up afterwards then. So, And one of the big things that we can do is after this, do everything we can to share this as a lessons learned. Because possibly the same exact thing is happening at the other sites over in the company. Maybe there's another safety professional you can talk to help share this lessons learned. Because anything we can stop in a proactive as opposed to a incidents happen and it's a reactive, we're going to be much, much better off then. So, and that is it for today's episode. Episode 202, we talked about the incident investigation steps. And of course, I want you to understand the nuance. There's not going to be a perfect incident, not going to be a perfect step by step. So I want to thank everybody for joining me today. My name is Dr. David Ayers. Thank you and have a safe day.